Good day, everyone. Richard Cowperthwait for Northwest Access TV. Thanks for joining us again. I have a couple of guests on our show today. An important event coming up next week that we're going to be talking about. I'm very happy to have on hand Melinda White, who is no stranger to Northwest Access TV, and my old friend Brad Ferland. And Melinda and Brad are the co-chairs of a Substance Abuse Addiction Summit coming up next week. I should note for starters, we're taping this show on Tuesday, July 9th. And the Substance Abuse Addiction Summit coming up Friday, July 19, 10 to 4 at the Champlain Valley Expo. And this is the third summit. Sounds like a big-time event, Melinda.
It is. We're very blessed. A few years ago, Brad had approached me and said that he had a vision to hold an event of some sort. And we actually, this is technically the fourth summit, but the third one at the Expo. The first one was a kickoff in Montpelier at the Capitol Plaza Hotel.
So actually, fourth one.
It is.
Actually, let me stop you there. I'm getting ahead of myself. Give us a little, again, a lot of folks watching us may be well familiar with you, but give us some background. I realize you could take a half hour by telling us all the stuff you're doing, but give us some of the highlights of your background, Melinda.
Sure. So I am a person in long-term recovery myself, which is usually the most important piece with all of the work I do. I have that to keep in consideration that I've struggled in my own life. So my path now is to help others. And I work for the Turning Point of Franklin County as a recovery coach supervisor in the emergency department, as well as a Blueprint for Health Vermont MAT lead, and that's medication-assisted treatment. And I've also served on a number of boards for the homeless shelter, for VTAR, which is the Vermont Alliance for Recovery Residences. So they serve both people struggling with homelessness in recovery. The community partnership, I host the Recovery Rockstar Show, and really everything that I do in my life, personal and professional, revolves around recovery from addiction.
Wow, a lot of stuff. Brad, give us a little background on yourself.
Yeah, so I've been in Franklin County since 1980. I think people think I was born here.
Really? Geez, I'm 5 years ahead of you. I probably didn't know that.
Yeah, and I, like Melinda, I've been in recovery for a long time, so it's an important topic to me. It certainly was a lifesaver for me to stop alcohol consumption. And live in the town. My daughter and I have sheep. And
I was going to ask you about your sheep. Sheep doing okay these days?
Sheep are doing great. It's a little warm for them, but we don't air condition the barn. So this summit was just something that we felt like the boots on the ground people really knew what was going on. People were dying every day in Vermont. They are dying.
As in are dying every day?
Are dying,
yes.
Yeah. And that there was maybe not as much sort of political attention being paid to the topic, and we just wanted to make sure in a responsible way that we could, really highlight a lot of things that are happening and what some good pathways are for helping people.
That's right. I just want to quickly note, as a media guy myself of sorts, Brad's got quite a media background and still does doing a talk show on WDEV once or twice a week, but many years with the St. Albans Messenger. And just mention your personal business, Brad. You do very well with your own business.
I do political and business consulting. I have for like 35 years, sort of behind the scenes, but really same premise as the summit, just trying to find solutions for problems.
Interesting. So the summit, we're talking, and again, Friday, July 19, 10 to 4 at Champlain Valley Expo. And how many folks are? You're the two co-chairs. You got a lot of people. Just give us some logistics about the summit.
Sure.
Melinda.
So Brad and I are the co-founders, and this is a grassroots event. So we've got, but that being said, we have so many partners that have been supportive. We've got some fantastic sponsors. Savita Health is our platinum sponsor this year. And then we've just got a slew of gold and silver and bronze sponsors, diamond sponsors. We have a booth room that consists of almost 100 different organizations, mostly from Vermont, some in New Hampshire, New York, Massachusetts, and Maine. So those are all organizations that are passionate about this topic too. And the way that the summit looks is that from 10 a.m. to 11:45 a.m. is the summit presentation, where we have the governor's office, we've got the health department sharing some data and statistics about substance use, and then we've got a number of different presenters, from everything from Don Tatro with Jenna's Promise to to Valerie Pilata with Josh's House, to Savita sharing Working Fields, Granite Recovery. So we've just got a number of organizations that are going to be sharing about what they provide for services around recovery. And also we've hand-selected the organizations that have models that we see that work, and we're hoping that as people attend and come, if they work in the field, they can see the models that work and replicate them. And then it is free to the public. No registration required for
People
public.
can just show up for this.
People can
no
show up
charge.
for it, yes. So to educate them too on what are the resources out there.
Yeah. Well, Brad, has this been getting bigger every year, Brad? Sounds like it?
Definitely getting bigger in all aspects. One, the support aspect has almost doubled in terms of sponsorship, and WCAX and Champlain Valley Expo, along with Savita, have really stepped up to the plate. They for promotion, and the fairgrounds is our perfect location.
Yeah.
And one of the things that was important to us was that if people were struggling in any way, they could come to a place where there's 100 booths, as Melinda said, and be incognito. Just look for help, but don't have to sort of, expose themselves to, maybe it's a loved one, maybe it's them, maybe it's, a neighbor, whatever it is, just to look for help.
Yeah. Resources for folks dealing with substance, and I'm also struck by a substance use addiction summit. Seems like when I see the word substance, it's typically followed by substance abuse. Purposely went to use and not abuse?
It did. So there's been a lot of focus on language that's used around substance use and attempts to reduce negative bias and stigma. And the word use versus abuse has quite a difference. So
Really?
that is kind of the new language that has been identified as more strength-based as substance use disorder. And we do have, for the presentation in the morning, as I mentioned, 10 to 11:45 a.m. And then in the afternoon, that's when the booth room opens. So from 12 to 4, noon to 4, is when those upwards of almost 100, if not more, booths open up to share about their services. And then we also have breakout rooms. We have 3 different breakout rooms. So in one of them, we have Dr. Suzanne White, who's board certified in psychiatry and addiction medicine. And she's going to be sharing about the 4th wave and the new drug trends, and then also the new treatment and recovery modalities that are used to address those trends. And then we've got Dana Bourne with the health department, who's going to be doing a workshop on tobacco cessation. And then we've got a recovery panel room, and I'm excited about this one. It's new. We're going to have a number of people who are in recovery and comfortable sharing openly about what their use look like, how they got in recovery, and what their journey looks like. So for people who are trying to learn more, especially family members, that's going to be a valuable room for them to hear from people firsthand on what was helpful, what was not, what were the resources. So if they're trying to help their loved ones, they have a better idea of what goes through the minds of those of us who have struggled with addiction. How do they not take it personally, right? Me struggling with drugs is not anti-family, it's just, right? So really trying to help people learn what healthy boundaries are, what resources are available. And the most important thing is for people to leave with a clear understanding that there's hope regardless of how far down the scale somebody may appear to have gone.
Right. Brad, more resources. Are you impressed over the years? Have there been more and more resources to help folks dealing with addiction issues?
Yes and no.
Yes and no.
Beds are a real problem, and that's why there's several things we're advocating for in this summit. One is we really need more beds. We have Serenity House and Valley Vista and Jenna's Promise and other places really do a great job, but if you have that moment of clarity where you want to get help, it's often very difficult to get help. So we're pushing a couple of things. We're pushing a tri-state model, meaning if somebody needs help and Vermont can't provide it, maybe New Hampshire can, which they often do.
Really?
There are beds over there. The Medicaid reimbursement is not enough. It's short. It doesn't pay enough, and it doesn't cover long enough recovery care. And to us, it's a no-brainer. If somebody goes in for 7 days and then just goes back to wherever they were, their likelihood of recovering is so much lower. The models are to get them into longer-term care and continue. And like Jenna's Promise, as we're talking, is a model of not only taking them from that first moment of crisis, but taking them to all the steps up of health, workforce development, all the medical treatment, all the things that a person needs to get back into, into a better place. And then we stress the fact that people separate the addiction from the person, that everyone is a beautiful human being, and the drug is something different, or the alcohol is something different. And that it's very important because we see cases where people just are shunning, somebody with addiction, when in fact they really can be brought back. Everyone can be.
That's right.
So.
I'm a stat guy, and if you don't have these stats, just pops into my mind. But Vermont, what about 640,000 residents or so? And is there a rough stat on how many of Vermont residents, say, are dealing with some form of addiction? Is there?
Those statistics are definitely available, and they will be shared at the summit. I don't have them off the top of my head, and I definitely don't want to misquote, but we have
double digits. Would that be fair to say?
Absolutely. And we also look at the stats of how many people are engaged in treatment in some way, and then also, there's no way to accurately count how many people are struggling and still need help, because if you can't in rural Vermont, if you can't reach them to ask them, you don't know. So we've got statistics, and yet I tend to be one of those people I like to be optimistic and also be realistic. And we don't have the ability to truly measure the accuracy of the volume of people struggling, because there's many who are still being missed because of being in rural areas, not having access to communication, transportation. So, but it's a very large volume of our population, very per capita. We are highlighted as one of those states who luckily are providing medication-assisted treatment at a faster and higher level than many other states, and yet there's still just so much more work to do.
Yeah, because I saw you kind of doing your thing not too long ago in the In Their Shoes walk.
Yeah.
I saw you kind of in action, so to speak, but I guess Vermont, second highest per capita homeless unhoused population?
Yes. And you couple that with substance use, and when we're looking at recovery, it's not just looking at how much is a person using or drinking in the drugs. It's really not that. It's more about the social matrix, and what does the person have for healthy pro-social connections and stability and basic human needs. And that's why I've remained passionate about both substance use and housing, because I can try to support somebody into learning how do they prevent picking up a drug again, how do they try to get healthier, get employed, go back to school. But if they don't know where they're sleeping that night, it's really hard to plan for the future when your pants are on fire. So it's like, how can we support people with a safe environment so they can do those healthy things and be productive members of society, and also know where they're going to lay their head that night?
Yeah. It just sounds like some just overwhelming issues almost here, but could we have some good people dealing with them? I did interview Paul Dragon the other day.
I love
who
Paul.
I met in there. Just seems like a real solid guy to me. But I had a good interview with Paul, the CVOEO chief. And I think the stat I heard that day of the In Their Shoes, Vermont, a rough estimate, obviously, of about 3,500 people on a given day, homeless, unhoused.
Correct, and those are the people, again, that we can actually find to count.
So who knows, maybe that may be understated quite a bit.
Absolutely understated. Yeah, we do a pit count, an annual pit count, which is the point-in-time count, and it's really one night that's being counted, but there's no way to reach all of the people living in the state to truly count who is not housed.
Brad, you said New Hampshire seems to do better with homeless issues in Vermont, with about twice the population.
Well, with beds. They
For
just
substance
have, they have more recovery beds available than we do in Vermont. And really there just should be no borders. In fact, it's intuitive to have somebody leave their sort of where they're using or whatever drugs here, if they're here in Vermont. Going over to a new venue in New Hampshire is really a great thing in some cases. So.
How would that transportation comes right to mind? If there's a bed in New Hampshire, how would that person typically get to New Hampshire from Vermont?
Somebody like Melinda might drive them.
We actually,
transportation sounds like a huge issue, obviously, in Vermont, or lack thereof.
It's a huge issue, and also, I'm going to do a shout out to Granite Recovery Centers, because they've got locations in Maine, New Hampshire, and I'll use a quick example. There was a person I was supporting who was at the UVM Medical Center for alcohol withdrawal, and that person got stabilized enough to leave, but they had no place to go because they had some issues issues happen at home. They weren't allowed back there. So we called Granite Recovery together, and Granite Recovery had that person just sit still for 3 hours and sent somebody to come and pick that person up and bring them to their program. So we still need regular public transportation for people, especially when they're continuing care and appointments and things that maybe Medicaid don't cover, or if they're not on Vermont Medicaid. But when it comes to the treatment centers, some of them actually will help with that transportation. Valley Vista has been, I get a shout out to them, and Serenity House. They don't get reimbursed at the rates that they really should be for the services they provide, and yet they have gotten more innovative in their way of supporting people who are struggling with barriers. So transportation, yes, is still an issue. I have a person stranded on the other end of the state right now trying to figure out how to get them back. And also, it falls on basically those of us who are passionate enough to get creative. But we need a system. It needs to be based on a system, not on people.
Yeah. How's the legislature? Do you think the legislature, of course, an issue that got quite a bit of attention, the safe injection site, am I using the right term for that?
Yeah.
Which the legislature approved, the governor vetoed that, and the veto was overridden.
Right.
Coming up in Burlington. Is that a good initiative as far as you're concerned, or?
I have to say, it's the biggest challenge for me. There's
either way about that.
There's strong feelings for and against it, and I won't say what my personal feelings are, whether it's for or against, but what I will say is that I was more against the idea only because, as we're highlighting, our residential treatment programs are suffering for funding. Our residential recovery beds are, so my concern was taking money for another new idea that may or may not work instead of using it on the things that are already working. And my fear is that, do I think the idea of lives being saved at a safe injection site is a good thing? Absolutely. And also the challenge is there's going to be case managers there. And if a person says, you know what, I've decided not only do I want to not keep coming here, I want to heal and I want to get off drugs. If we don't fund those other programs, we're funding stuff for people to keep using safely and to medicate them, but we're taking funding away from people healing and thriving. So that for me, it's not against the program. It's just against the idea of taking money we really can't afford to spend on another new idea and we've lost Maple Leaf, we've lost Brattleboro Retreat. We keep losing these places that work and help people get off drugs and heal. So I do have a strong feeling about the way that we use that money. I don't think it was wise. And it's nothing against the idea of the overdose prevention and safe injection sites. It's just about we can't afford to fund what we already know works and is needed. So why did we do that? It pained me to see that, this year at least.
Brad, thoughts on that?
Yeah, I mean, the summit itself, we've stayed agnostic to all vehicles for recovery. But I concur with Melinda. It's $1 million, and the stats are
what the price tag is? I forgot.
1.5.
1.5.
And the stats are that people come from more close proximity.
Sure. How are they going to get there if they're far away in the first place?
They bring their own drugs. They don't know if these are lethal or not. They may overdose. It's just beds would be the best solution, and trying to move people towards a positive outcome rather than just that's sort of our personal opinion, but we do what we can do.
Yeah, and I guess just for the record, too, I am definitely all for harm reduction approaches. I've been a huge advocate for Narcan since the very beginning, before there was a pilot site here. So I am for the idea of harm reduction. I think the challenge is that I've seen over the years that now our full focus is almost only harm reduction, and why are we losing the focus on healing and growth? That's the challenge, is that the pendulum, just like with responding to substance use in a punitive way, which used to happen, that stopped, and I think that's wonderful. But now the challenge is we coddle too much. So it's like the pendulum keeps on moving in a direction where it's like we just want to keep people alive, or we just want to coddle because it's not their fault. But we got to get realistic, accountability. Let a person have a little skin in the game in their own recovery, but definitely support them. So there's a balance with all of that, and I think that's one of the fears that I have, and I'm hoping that the summit will show, is that all the pathways are good, right? None of them are bad. And also, if somebody's really going to live their life to the fullest, wouldn't it be great if they found a way to no longer be using and get their own residence and acquire these skills? And how does that happen? It's by them doing the work and us providing them the tools versus us doing the work for them.
Yeah. How do you police have their hands full on so many fronts these days? I mean, crime's such a big issue.
Yeah.
How do you feel police are working with addiction issues and stuff? Are they Any thoughts on big, broad question, but
Well, yeah, no, it's funny you asked that because with the summit, I mean, for the first three,
will
Chief
there be a
Lamoth and I.
police presence there, in fact?
Absolutely. So Chief Lamoth and I have presented together. We've partnered up for the summit for multiple summits.
St. Albans Police.
St. Albans PD, yep. So, I mean, I can speak for our local PD and even, the Vermont State Police I've partnered with, the Swanton PD, the sheriffs, and St. Albans PD, but especially the St. Albans PD under on Chief Lamoth's watch. He's been very interactive with community partners, and he also, as you know, was the one who started the embedded mental health crisis workers when he was with Vermont State Police. So I think that for us locally, we're blessed with who we have in law enforcement because they're very good at partnering, at identifying that, we don't know all things, but we know who does, so we partner closely. So that way we're responding to things in an appropriate way. If it's a mental health crisis, we're not going to arrest them, we're going to have a mental health crisis worker. If it's somebody struggling with substance use, if they break the law, okay, we're going to have to arrest them. But then when they're at the barracks, they may call me and say, can you come and talk to this person? They want help. So for me, I mean, it's not to put rosy sunglasses, but our local law enforcement shine above many, and they've been used as an example on WCAX. There was recently a story about St. Albans PD. So we are blessed because they are open to strong partnerships in order to make our communities safer and healthier.
Nice to hear that. Brad, any thoughts on the police front?
Well, just what Melinda was saying, that the more partnership there is, so that it's not just strictly like arresting people, it's giving them some alternatives. That said, there are people that are coming into the state and dealing, they're holding hostage Vermonters, they're setting up apartments in rural Vermont, they're dealing drugs, the drug train from New York City, from Springfield, Mass. It's heavy and it's there. And really, we advocate for a few things. One is that, maybe more effort on that, because the neighborhoods know where the drug dealers are and stuff, and it's very complicated to make arrests. But I think we've got, in these cases where people are, in the case of Jenna's Promise, poor Jenna.
Jenna's Promise is in Johnson?
In Johnson.
Okay. Sounds like a great organization.
Jenna Tatro was this amazing young woman who wanted to get out of addiction and just couldn't, and then was sort of almost purposely overdosed. And that's happening. This isn't anecdotal. This is happening in Vermont.
Wow.
The other thing that's important, that our prison system, we think we're seeing some improvements, but so many people are incarcerated because they were, using substances of some sort during things. And there could be a lot more recovery and there is now starting
in the prisons?
In the prisons where embedded worker kind of
Recovery coaches,
coaches are going in. And these are the things that, are going to save money. If somebody gets let out of prison and then has a pathway to recovery, maybe they won't go back. If they have a longer term stay in a recovery house and then get into a program where they do workforce development and get a job, have a little more financial security, the savings are going to be enormous.
But the recidivism, is the right word?
Yes, recidivism would be reduced.
What's that? I mean, just so many people who get out of prison, I mean, a significant percentage end up going back.
Correct, and that's what the measurement is for the restorative justice centers, for the recovery coaches being embedded in the jails. The goal is to reduce the recidivism, so somebody comes out of jail and they stay out of jail because they've gotten the tools they need to no longer continue committing the same crimes or to not go back to use, because many people may not break the law every time they use and drink, but most of the time, if they've broken the law, it's because they've been using and drinking. So it's getting to that root, and we need to take them out of play when they're on a destructive path, go ahead, put them in jail, but then also how do we prevent them committing the same crimes? It's give them treatment while they're incarcerated, and oftentimes the window of willingness is larger when they're incarcerated. So it was a missed opportunity for a while, but we're seeing a little bit more progress to get services brought back into the jails.
It may be a stupid question, and I try to think not a lot of questions are stupid, but of all the folks who have addiction issues, Most of these folks would like to get out of that, or all of them, do you think, or most people?
I
or
think it depends.
Maybe that's a crazy question, I don't know.
It's not a crazy question. It's just there's no blanket answer, because some people are in the phase of addiction that they haven't hit a point that they feel it's really a problem.
Yeah.
So if somebody's ambivalent and they're not really seeing that it's a problem, it needs to be worked on, then they're not willing. And yet oftentimes people eventually have some kind of an event happen that makes them look at and analyze their use and realize this might be the root cause of why I have all these issues. So
And we can't understate the power of addiction, right? People who are addicted, they wake up in the morning and they feel horrible. They look in the mirror, they look horrible. They're not functioning in a lot of things they want to be doing. They lose jobs, they lose cars, they lose family. All these things happen, yet there's this strong physiological compelling thing that's saying drink more or take that drug again. And it's very, very difficult. And like Melinda says, if there may be that moment of clarity, there may be an incident that happens that they go, okay, enough is enough, but it's difficult.
Yeah.
But the key is, and this is one of our key things with the summit, is when they have that moment, let's save them. Let's get them someplace where they can get help.
Right, get the necessary resources. And
exactly, like have the resource available, reduce the barriers, and that's usually when people ask me what I do for work, because my title and it's changed so much, but the reality is it's being a barrier buster, like breaking down those barriers that are taking longer for somebody to get accepted and to get the help. And that's why Friday, July 19th at the Champlain Valley Expo, we have this summit from 10 to 4. It's open to the public, no registration required. The more people that can show up, the better, because I get contacted through Facebook, through media, people saying, I need help, my loved one's struggling, what do I do? And that's a big reason for me. I can point them to this event because it's hard to respond to the hundreds of asks that come over time. And it's like, this is a place where all those people can go and learn where there's hope.
Are there some buses or anything for folks who don't have much transportation? Is there any easy way for if they're far from?
The public, at least in Chittenden County, the public transportation.
Chittenden County's not in too bad shape, but for folks away from Chittenden County?
We don't have the resource for that, but.
But I love that idea because we've talked about it, and I would love for us to be able to find a way to bus people to it.
Yeah, no, it sounds like that's, again, one of those issues in Vermont that's such a tough issue to deal with, just lack of public transportation, especially away from Burlington and Chittenden County.
And we really hope that, I think the political world is waking up on this. They've got some, some settlement money to put different places. We encourage incumbents and those who are running to come and attend. And these are boots on the ground people who absolutely know how recovery works and where best to spend the dollars. They could learn a lot if they came.
Yeah, I've got a first cousin, actually, I'm going to see him tomorrow, first cousin in Burlington, who I give a ton of credit to. Of course, he said, no, Richard, you're so together. I said, cousin, you're so together, but he was a homeless person on the streets in Burlington for years, has been sober for 20 years, and a way more together person than I am, but I give folks like, in my case, my first cousin, a ton of credit, give a ton of credit to you folks for just doing this. 15 seconds again, just a quick wrap again on the Substance Use Addiction Summit.
Yeah, so the third annual Substance Use Addiction Summit is Friday, July 19th at the Champlain Valley Expo. The summit presentation is from 10 to 11:45 a.m. and the booth and breakout rooms open from noon to 4. There is live entertainment, bands, music, dogs. Come and join us.
And some food, I suspect, too.
Oh, there's food. Bring the food and they'll come.
And it's free and everyone's welcome.
Sounds like a great event. Many thanks to Melinda White and Brad Ferland, the co-founders of the Substance Abuse Addiction Summit coming up next week. Thanks a lot for your time.
Thank you, Richard.
Thanks to my producer, Josh Pryor, doing all the hard work back there. I'm Richard Cowperthwait. Thanks for watching us here on Northwest Access TV. See you next time.